Hello. So, good afternoon, everyone. Today's session is going to be really helpful. It's led by Dr. Sushanta from Apollo Cradle and Children's Hospital. He's going to talk about anemia in children. So, stick around until the end. Ask us your questions if you have any. And let's not keep you wait any longer. And, Doctor, you have the stage.
Thank you. Uh, Good afternoon, everybody. In this live session, we will be discussing the issue of anemia in children, what the parents should know, and how to manage this condition. So, anemia is simply decrease in hemoglobin content of the blood in the baby. So we know that we have blood cells, that RBC. They have a pigment called hemoglobin that gives us the pink or red color to the skin. Um, the hemoglobin level is of different level at different age group. So it is highest at the birth, and then it starts decreasing, and then it starts to build up. So the definition that uses medical science to call it anemia is varying from different age group to age group. So if first 6 to 5 years, 6 months to 5 years age group, it is less than 11, then it is called anemia. And from 5 to 12 years, if it less than 11.5, it is called anemia. And from 12 to 14 years, it is less than 12, then it's called anemia. So parents often wonder what is the concern of anemia. So as we know, hemoglobin is the basic molecule that carries the oxygen, and it transports the oxygen to different tissues. So the oxygenation is important for functioning of every tissue. So anemia hampers the normal function of the whole body. So anemia can be of different levels, like mild, moderate, and severe. So mild anemia may not be causing issues right there, but it starts to harm the baby on the background. So when it gets into the severe and moderate severity, then it starts to show symptoms more in frequent manner. So anemia first manifests as a general weakness, poor appetite, reduced capacity for playing, decreased interest in day-to-day activity, and the baby becomes more prone for severe infections. So also baby loses the uh, attentiveness. Baby becomes more irritable. The scores in the school performance becomes less and less. The memory part, the reading and speaking, the mathematics skills, they also get affected as the anemia severity progresses. So often parents miss the level of anemia when it is mild. Mild anemia is not always discoverable by visual inspection. Often tests, when done for other reasons, that detects the anemia, what is a mild level. But in severe anemia, baby looks very pale. So whenever uh, a baby is looking very pale from inner lips or by hand, then you should really contact your pediatrician as soon as possible. So, first, what are the symptoms of anemia? As we know, the general symptoms, non-specific symptoms like loss of appetite, decreasing in intake of food, repeated infections, um, loss of concentration ability of the baby. These are the non-specific symptoms. Very specific symptoms will be like baby will start eating mud, soil, the whitewashed paints like tuna, the paper, chalk, pencil. These are the things that we call pica. So if you notice baby is having this eating habit of these abnormal things, then also it is a part of anemia manifestation. So and when baby becomes really pale, then it is more obvious, so that anemia is detected. So next will be why anemia happens in babies. Most common, there are lots of reasons of anemia. The most common reason of anemia is nutritional anemia. Nutritional anemia means there is lack of nutrition which are important for manufacture of the hemoglobin molecule. Hemoglobin needs iron, folic acid, and vitamin B12 for the optimal production and functioning. So, whenever there is lack of iron in the diet due to lack of balanced diet means this lack of iron-rich food, where in excessive intake of animal milk, as animal milk is poor in iron and bioavailability, that is whatever amount is there, this also get absorbed very poorly. So intake of excessive animal milk like cow milk is also a common reason of iron deficiency anemia in India. So um, some disorders like celiac disease, where the absorption of this iron and folic acid is also hampered. So the absorption deficient diseases where the nutrition is not absorbed, that is also can cause nutritional anemia. Presence of worm infestations, that also leads to the nutritional deficiency and anemia. If there is ongoing bleeding from anybody, anywhere in the body, like fissures, piles, or there is some chronic bleeding tendency of the baby. So that's also calls the anemia due to bleeding disorders. There are some physical diseases like thalassemia and some malignancies, where there is will be destruction of RBC or underproduction of RBC. So that will also call lead to anemia. So most common is the nutrition anemia. Uh, the chunk that is due to diseases are less, and they will be manufactured by the sickness of the baby also. So parents should be able to take care of this nutritional anemia, so that this majority of cases will be handled. So what parents can do to prevent this onset of anemia? First will be prevention, then we will talk about treatment. So prevention, first will be to three things we can do in prevention. First, managing diet. Second, giving routine iron supplement. Third, routine deworming. So first, managing diet means in first 6 months, the breast milk is the best diet that will prevent iron deficiency anemia. In addition to iron deficiency anemia diet plan, so breast milk, whatever amount is bioavailability is better. So first 6 months you have to do breastfeeding only. After 6 months, the iron content of the milk is not sufficient enough to support the requirement of the body. So we have to start solid foods that are rich in iron, like green leafy vegetables, jaggery, pulses, chickpeas. If culturally acceptable, then non-vegetarian materials like meat, egg can be a good source of iron in our diet. So first of all, we have to reduce the milk intake after 6 months in proportion to the meal we are giving. So we have to try to build up the meal intake and decrease the milk intake. So in as an Indian parents, often we are obsessed with our milk intakes. We think it is wholesome food. So it is not true. After 6 months, we tend to decrease the milk intake, and by 1 year, it should be like that. In whole 24 hours, the milk intake should not be exceeding 500 ml in total. Second strategy to prevent iron deficiency is routine iron supplement. From 4 to 5 months onwards, we advise routine iron supplement for every baby, and government is also taking initiative for the school going children and adolescents. So contact your pediatrician for that details. So routine iron supplement is advisable, uh, even if diet is your diet is you think is sufficient. Third is the routine deworming. Is the national program also. The routine deworming twice in a year after 1 year of life is advisable for every baby. Once you suspect of anemia, then you have to do some tests. If it's mild, then that's fine. If severe anemia, then you have to run additional tests to determine whether it is only nutrition deficiency or some coexisting illness is there. So once we have confirmed that it is nutritional anemia, then the treatment is simple. The replacement of the uh, depleted element, that is iron. If needed, vitamin B12 and folic acid are given in addition. So first will be the intake of iron. Iron is given for minimum of 3 months, so to replete the deficient stores also. So once the iron supplement is started, the response is drastic. Within 1 to 2 weeks also, you can notice the general condition of baby is improved. They become, the general outlook is improved. They become playful. They start having attentiveness. So often people discontinue iron after 1 to 2 months, but you have to give for at least 3 months. Second, reduce the intake of milk and milk product after 1 year, so that baby will be interested in taking the solid food. That will be beneficial for both growth and this anemia thing. Second, provide a balanced diet for the baby. For vegetarians, this is green leafy vegetables, pulses, tofu, soybean, peanut, jaggery. These are the things which are having rich content of iron. Uh, for non-vegetarian options, egg, meat, fish are a good source of iron. So, a few practical tips to be remembered when we are having iron treatment. First, it is to be given in fasting state for better absorption, and should not be taken with milk or coffee and tea. Second, iron syrups can stain the teeth. So, whenever iron syrups are taken, it should be followed by a rinse of mouth with water, so that iron doesn't stain the teeth. Um, the frequency at which adults are affected with iron causing constipation, loose motion, the frequency is lesser in babies, but if it's not causing severe constipation, it should be continued. Um, few babies manifest with dark color stools, and these are the uh, harmless side effect of iron intake. So that should not be an issue to discontinue. So as a whole, nutritional anemia is very much preventable and easily treatable. So we have to be careful enough in our diet so that it will be preventable, and at all it is there in the baby, it should be identified and treated as soon as possible. uh, I think we can take questions now. If there is no questions, we can finish. Okay, so thank you for the session. uh, okay, okay, thank you.